Today we learn about the mechanical ventilator. In ventilator settings, what is the trigger, how the ventilator triggers, how the patient trigger, and what it is the trigger. We'll discuss about the trigger in detail. Myself is Dr. Rachna, intensivist. I am working in the ICU. So we'll discuss about the triggers. So what is the trigger? So a trigger is a signals that start a ventilator breaths. So it determines when the ventilator has to deliver the inspiration. So either it could be initiated by the ventilator machine or it could be initiated by the patient. So whenever the ventilator breaths is initiated or inspiration is initiated, that is the trigger. So it could be the patient trigger or it could be the machine or ventilator trigger. So now we'll see the types of trigger. So how many types of trigger? There is a pressure trigger, then it's a flow trigger, and it's a neural trigger, and other is the time trigger. So whenever we talk about the time trigger, it means the ventilator has to start the breaths and it will be fixed on fixed interval according to time how we set. Then coming on to the pressure trigger. So whenever patient will generate the negative pressure, his diaphragm will generate the negative pressure, the breath will be the machine will be sensed that pressure, and that the sensing, after the sensing the ventilator patient's negative pressure, the breaths will be the initiated. So that is the pressure trigger. Next is the flow trigger. So whenever in the ventilator circuit there is the difference between the flow, that change will be sensed by the ventilator and the breath will be the initiated. So whenever the patient will generate a spontaneous breath or he will initiate the breaths, the flow is sensed by the ventilator and trigger will generate, and so it will be the patient trigger. One more is there, that is the neural trigger. So that is the NAVA, so neural assisted ventilator. In that, the lead will be sensed by the lead will sense the diaphragm electrical activity. So that activity will be transmitted to the brain and then breath will be the initiated. So that is the neural trigger. So now coming on to the time trigger. So what is the time trigger? So whenever the breath is delivered at the fixed interval by the ventilator, it means that is the time trigger. So ventilator will generate on the fixed interval. So it will be the independent of the patient's effort, totally depends on the ventilator machine. So this time trigger can be used in the control mode of ventilation. So usually where we see the time trigger, we can see in the volume control, we can see in the pressure control when the patient is passive. So for example, like we have said the 16 breaths. So RR is 6, we have said the 16. So every breath will be delivered after the 3.575 seconds. So that is the time trigger. Next, coming on to the pressure trigger. So ventilator sense the drop in airway pressure that will be the cause by the patient effort. So that is the pressure trigger. Usually what the patient will generate -1 to -2 centimeter. If that patient is generating this much of effort, the ventilator will sense and that breath is initiated. So what is the pro of that? So it is actually, it's a simple or widely available. But there is a problem with this. What is the side effect is this? In this case, if patient is generating -1 or -2 centimeter of water, there will be the higher work of breathing. So this pressure trigger is very less sensitive and is delay the trigger also. Next, coming on to the flow trigger. So flow trigger is most commonly used in the modern ventilator. So what is that? So whenever the ventilator detects a change in flow during the inspiration, so that is typically we set is the 1 to 3 liter per minute, and this is the more sensitive and widely accepted, widely used. And in this case, there is less patient effort. So, but in flow trigger, the better patient comfort and synchrony. But side effect is there is this is the too sensitive, so auto trigger will be more with this. Now coming onto the neural trigger, that is the NAVA. So this is the trigger by the diaphragm electrical activity, and this requires this facial catheter. That catheter goes into the through we put through the nose, and this goes into the stomach near the diaphragm, and the diaphragm electrical activity triggered by this, and thus this signal is transmitted to the brain. Then that ventilator sense this. So this is the better synchrony, but it's a costly and its availability is very limited. Now coming on to the trigger sensitivity. So key concept is the setting. So what we set, effective, too sensitive, auto triggering can be generated by the leak, water and cardiac oscillations. So whenever this auto triggering is happening, we have to check for the leak, water in the circuits and cardiac oscillation. Not sensitive to enough, it means that trigger will be the missed, effort will be the missed and increased bulk of breathing. So our goal is to respond to true patient's efforts only, and we have to set the proper trigger whenever either we are setting the flow trigger or we are setting the pressure trigger. Then coming to the appropriate trigger or normal trigger. So how we decide? Whenever the patient and ventilator is having the good synchrony, it means that we see and the waveform signs. The small negative deflection has happened. That is the inspiration we can see on the graph. So there is a smooth inspiratory flow rise and there is no extra breaths. It means there is no need to do the any change, and your patient and ventilator synchrony is proper. Next, coming on to the problem with the trigger. So what all problem can happen with the trigger? Sometimes auto triggering can happen. So auto triggering, why it happen? It causes due to the leak in the circuits, secretions in the circuits, or excessive sensitivity due to. Then why how we see that problems? You will be getting the respiratory rate more, respiratory more than whatever you have set it, and there was a no patient effort, and still you will see all these things. It means auto triggering happens due to these causes. Mistrigger, it means the causes the patient effort is very weak, and trigger is insensitive. It means the effort is weak and we have set the high sensitivity of the trigger. So that trigger will be the missed, usually seen in the COPD patients, fatigue and deep sedation. Now coming on to the delayed or double triggering. So whenever breaths start late after the patient's effort, you can see in the pressure waveform, large negative reflection is happening, long delay before the inspiration. So prolonged expiratory phase before the inspiration, we can see in the flow waveform. So what is the common causes for that? It could be the pressure trigger is there, या फिर high intrinsic PEEP and poor settings. So how we set this delay trigger? We can switch. Once you have the pressure trigger, we can switch over the flow trigger. We can optimize the expiratory time and we can add the additional PEEP. What about the double trigger? Double trigger means that is the two breaths. So two breaths for one effort. So the two inspiration with the minimal expirations. So what we can see? We can see is the high drive or either short inspiratory time. Whenever we set the short inspiratory time, there will be the double triggering can happen. So inadequate tidal volume. How we fix this? We can increase the tidal volume or we can increase the inspiratory time, and that improve the synchrony. What is the trigger troubleshootings? What all problem will see? The patient and ventilator and asynchrony will be there on the monitor. So we have to look for this. If RR on ventilator is more than RR on ventilator and patient's RR is not matching, it means that there is a problem. Accessory muscle is using patient, double triggering or breath stacking, patient discomfort or tachypnea. If you are seeing all these problems with the patient and ventilator, it means there is a problem with the trigger. So how we have to fix this trigger? What we can do? If we have set the too much sensitive trigger, either flow trigger or pressure trigger, so we have to reduce the trigger. If we have set the flow trigger that become -1, then we can increase -2 and 3 liter per minute. if we have set the flow trigger 1 liter and patient is triggering, so the trigger will be the high. So we have to reduce the sensitivity. It means we have to go up to the flow liter. So 2 to 3 liter will increase, then automatic the sensitivity will be reduced. If we have set the pressure trigger, so then we have to decrease the pressure sensitivity for the trigger. If we have set -1 centimeter of water, then we have to go for the -2. Then we have to decrease the sensitivity. So what if the water is present in the circuit, we have to decrease the drain the water, and if leak is there, we can fix the leak. So consider the pressure trigger if any persistent is the problem is there. So thank you. Keep watching. Subscribe my channel. If you have any question, then the comment box. Thank you.